Good afternoon, everyone. My name is Josh Epstein. I'm the marketing specialist for the TDA Perks program, and we connect members to professional and life resources, insurance options, money and time-saving programs, CE resources, networking events, and more. So whether you're working within a DSO, private practice, or have a practice of your own, Perks has something for everyone at every stage of your career. In today's presentations, we'll learn about one of the newest member benefits available to TDA members. During this session, you'll hear what the healthcare program entails and how you can take advantage of this offering. TDA members now have access to a healthcare member benefits program that utilizes a national PPO network and is available in all 50 states, plus the District of Columbia and Puerto Rico. Available to dental practice employers with employees, 1099 contractors, and sole proprietors. TDA Financial Services Insurance Program is offering this member benefit through its partnership with CapCare. As a member of TDA, you will have the opportunity to participate in the member benefits program by becoming an associate member of Local 426, which provides access to, among other items, healthcare-related benefits that include medical benefits, as well as prescription benefits, life insurance, accident, and various educational programs. Members can enroll the first day of any month with open enrollment. Today's speaker is Bridget Guys. She's the Chief Marketing and Sales Officer with Concord Management Resources. Bridget, thanks for being here. The floor is yours.
Thank you, Josh, and thank you everybody for attending today's webinar. Hopefully we can give you some information, not overload you, on what the program is, how it came about, how you can get a proposal, how our team can assist you and help you make a decision if this is the right plan for you, for your employees, for your family. So as just mentioned, this is a member benefit program that is available to members of Texas Dental Association. And the way that we are able to offer this program is through a union-based relationship. So we have a sponsoring union that we tap into, but we have our own local union, and you'll see that, Local 426. Basically, it is an exclusive member benefit program. You, as a member of TDA, have access to this program. And as Josh mentioned, it's as easy as you becoming an associate member of Local 426. Because you become an associate member, you have access to the healthcare benefits, which is 9 plan designs, as well as the ancillary products. It is a unique opportunity. We will go into a little bit more detail as to what it means and all the other partners. So about the program, the sponsoring union, Local 298-22, is what's called a Taft-Hartley Self-Insured Health and Welfare Benefits Plan. They currently have over 10,000 participating members. And the nice thing is they're a large employer, so they take the risk on behalf of all the enrolled participants, including Local 426. They give us rates every plan year, which begins January 1st through December 31st. They give us the plan designs, and then we're able to take those plans and those rates and bring them to you. So the renewals are based on the new rates every January 1st are based on the total population, including their 10,000 members. So it's not based on your own group's experience. It's not based on solely the Texas Dental. It's based on, right now, we have about 15,000 total participants, which, you know, the benefit of large employers, you're able to spread your risk and benefit from the economies of scale. So because Local 298-22 is a self-insured program, they contract with all the various vendors. So they contract with the network, which happens to be the Blue Cross Blue Shield National PPO Network, and their pharmacy vendors, and we'll go into who those pharmacy vendors are as well as third-party administrators, which includes us. One of the unique things and some of the nuances, we'll go into that, but Local 298, they oversee the claims processing. They send out the ID cards and the EOBs, right? Because they are the sponsoring entity. But otherwise, the program really does walk and talk like any other type of commercial program that you would be enrolled in. Give you a little bit of difference between kind of the commercial market versus this program. So if you're enrolled in a program today, either through a Texas-based program or the exchange, the networks that you have are going to vary. They can be a point of service network, HMO network, EPO network. But this program uses the national PPO network. So when your providers submit claims, they're submitting that to Texas Blue Cross Blue Shield PPO, one of the largest networks from a provider count. The in-network coverage for a program like this is all 50 states plus DC and Puerto Rico, where a program that you have today, your in-network coverage is typically within the state where you reside. You might have out-of-network benefits, but anything that falls outside of the Texas networks, right, Texas Blue Cross Blue Shield, would fall to an out-of-network benefit, or if you buy up to the Blue Card, the national network. With this program, coverage cannot be denied. With other programs, they're typically medically underwritten. They can apply a pre-existing condition. They also use census data based on age, number of dependents, where this program utilizes 4-tier rates. So you have a single, employee plus child, employee plus spouse, and family rate. This program is also available to sole proprietors, 1099 workers, where, again, you go into some of the other commercial products, small group products. When ACA came about, they excluded sole proprietors. They excluded husband and wife groups, where with this program, any one person is eligible, including 1099 employees. So to give you a little bit of the benefit highlights, these are plans. We have 9 plan designs. They are ACA compliant. I believe 8 out of the 9 are ACA compliant. I'll go into some of that detail. 100% preventative coverage, part of ACA is available on 8 out of the 9. Again, I'll go into those details. But basically, you have your doctor, specialist, urgent copays. You have copay only plans where there's no deductible, no coinsurance. We have deductibles that range from a $0 deductible to a $6,000 deductible. Coinsurance ranges from 100% coverage to 50% coverage. And then we also have maximum out-of-network pocket ranges, maximum out-of-pocket ranges from $5,350 to $14,700, which tend to be very low in comparison to the commercial market. So, some of these programs, the rates may be a little bit higher. The plans might be a little bit different, but when you look at these programs compared to the programs you have today, there are many benefits that you don't get. National network where you don't pay, low maximum out of pocket. So again, it's no pre-existing, no underwriting, which is very attractive to a lot of small employers, especially if you have a diverse population of employees or an older population. So a few things about the benefit and plans. So all of the plans are static. They can't be changed or revised. Regardless of your initial effective date, everybody will have what's called an open enrollment renewal to review the plans and the rates every January 1st. We do have an option to renew as is or continue as is at the new rate option. But regardless, again, if you come on February 1st, you'll renew January 1st of next year. So with a program like this, with a large employer, they do have the ability to decide their benefits. So one of their benefits is, they have an exclusion to certain specialty medications. We do have a formulary that we can share with you. And when we talk about some of these medications, they are your high dollar, high cost medications that are excluded. However, they do work with a third party payer matrix that works with a member to obtain different manufacturer rebates, cost savings, coupons to help with that overall cost. So again, prior to you enrolling in the program, we want to make sure you have the information that's needed, and then we can provide those formularies. We can reach out to the union in advance and ask any questions that you might have. The other exclusion is automobile accident coverage. So the union does not pay for medical expenses related to a motor vehicle accident. I know that may shock some folks. Ideally, it's, when you look at it, you really don't think about it when you have your auto insurance and then other medical plans come in as a secondary. But part of the reason is that only 0.8% of all medical claims related to an automobile accident are paid by a health plan. What we have done, because we understand that was a concern for some folks, Texas especially had some limitations with what personal liability limits could be applied. We are implementing an unlimited auto medical reimbursement rider. So it's outside of the medical program. It is a rider that is included in this. It is in your premiums that you pay on a monthly basis if you choose to enroll in the program. So it provides an unlimited auto medical reimbursement. If you select family coverage medical, you'd have family coverage under this program. And then it also provides, in addition, $150,000 accidental death and dismemberment. It's $150,000 per employee member, and then I believe it's $37,500 families. So again, it covers that gap from the union, and we just felt a need to put something in place to kind of minimize that that fear that folks might have. So as I mentioned, we have 9 plan designs. I'm not going to go through all of these step by step. Well, I know that this is going to be emailed out to everyone and potentially put up on the website. But basically, our programs start with our lowest cost plan is a $3,000, $6,000 deductible program. It has a 50% co-insurance, and the maximum pocket is $5,350. So in any given year, you would pay your deductible first, 50% of the co-insurance, but your maximum out of pocket, what I call your parachute, is significantly lower, which is $5,350. So this is a good plan for someone that maybe doesn't have a lot of immediate medical needs. They go to the doctor for preventative, which is covered at 100%. They're relatively healthy. This is a good plan. It's a good starting point. There is no out-of-network benefits. One reason being, again, the program utilizes the National Blue Cross Blue Shield PPO network. 96 to 97% of all providers participate in that network. So the chances that you would need an out-of-network provider are slim. Granted, it does happen, but we provide you with a link to look up providers. But another nice thing is maybe you take a few prescriptions. This program is unique where the prescriptions are at a copay level. They don't apply to deductible first, right? So you can pay copays for prescriptions, and then just your deductibles for medical expenses, okay? If we go to our next kind of baseline plan, we have a $2,500 deductible plan, 80% coinsurance, meaning you pay 20%, maximum out of pocket's a little bit higher, but for your physician and specialist services, it's at a copay, right? So your deductible and coinsurance are really on your high dollar inpatient, outpatient services. Otherwise, you're paying, copays for doctor's visits, preventative care is covered at 100%. And then your urgent care is also emergency rooms, $200 copay. And then urgent care is deductible, then 20%. So it does have an out-of-network benefit that if you do choose to electively go to an out-of-network provider, you have coverage. Same with the prescriptions. Prescriptions are covered at a copay only. So we do have retail and mail order available. If we go to some of the other plans, and again, as these plans move forward, the cost goes up, incrementally. We have a plan, no deductible, 100% coverage, copay only, and you have a very low maximum out of pocket for services. Where we have our richest plan, it's a copay only plan, no deductible, 100% coverage. Even your hospital stay is inpatient is a $250 copay per stay. This has an out-of-network benefit. Again, your prescriptions are covered at a copay. Ironically, this is our third most popular plan. It is kind of what I call sleep insurance, where God forbid anything happens, your out of pocket is very limited based on copays. You do pay more. I believe the family, the individual premium is $1,000. Family is about $3,000. But again, you're going to pay significantly less for out of pocket expenses. So these are the 9 plan designs, and we'll get into how you can get the pricing for these plan designs in a moment. But in addition to the 9 plan designs, the program also offers ancillary products. There's no medical questions to enroll. They all pay out a lump sum benefit. It can help pay for some of the out-of-pocket medical costs. So if you do get a high deductible plan, you could use that to offset it. It has extended continuation, meaning if you ever leave this program, you can continue coverage, and there's no pre-X. So these are nice programs, including the life insurance. There is no questionnaires. We offer a life insurance at 10, 20, 40, 50, and 100,000. It is age-based, but the employer does not have to do the any testing or anything as it relates to these programs, because each individual can enroll independently in the program. So now that we're through kind of the benefit, what we want to do is try to make the next process as easy as possible. So we have an easy enrollment process. Basically, you can request a member benefit program proposal, which then gives you an opportunity to look at the plans, look up providers, determine what plan is best for you. You receive a link to activate an online account. So you set up your account, enter your information, your group profile. You can set up your employee classes, payment method, add employees if you have them. You can send employee account activation links. Then they would set up their own accounts, and then everybody e-signs and submits. So what we do is all online. You set up a payment method online as well. But basically, what we want you to do is take a look at the program. It may not be a fit for everybody, but we do feel that it's worth comparing. We have a team that's available to help you answer any questions. help you, determine how the benefits work, what have you. So the first step for you would be to request a member benefit program proposal. You could send an email to capcareenrollment@concordmgt.com. And we'll just ask you for a little bit of information, your name, group name, zip code, email, preferred effective date. Once we get that, we'll send you a proposal. It's going to be sent from CapCare Notifications at Jet Insure. We do ask that you check your junk or spam or add the email address to your safe list so you can capture it. And then in addition to the proposal, you'll also get an email with an account activation link if you want to move forward. Again, if you don't want to move forward, you don't have to click on that link to set up an account. But basically that email is going to come from the same email address. And then you would set up your account, create a username and password, and log in. If you do need assistance with account activation, let's say you decide, you get a proposal tomorrow and you don't want to enroll until April 1st. The link may have expired, you may have forgotten your password, you can always email our team and we can help you. So the proposal that you get today, the same rates will apply if you enroll March 1st, April 1st, December 1st. So the rates are good through the end of December. If you have additional questions or need additional information, you can always call our toll-free number, our concierge team, at 833-287-4765. So just wanted to show you, here's the sample emails. This is what the proposal email looks like. So you kind of have an idea of what to look for. And then here is the account activation email. It does ask to verify your account. It asks for your employer name and zip code. Your employer name, you would enter it as shown here at the top, and then you would enter the zip code that we use to generate your proposal. So that really gets you started. To finish an application, if it's just you, it takes about 15 minutes max. If you're adding employees, it might take 5 minutes more. And then your employees can, again, you can send the link and they can complete their online enrollment. So here's what the URL, the site is, and you would enter your username and password, and then you're moving forward. So just a few things about the program. So you have the ability, employers, members have the ability to enroll on the first of any month, okay? Open enrollment closes 30 days prior to the effective date. So right now we are in open enrollment for a March 1st effective date. So open enrollment will close January 31st. Any employee or member enrolling with a dependent spouse or a dependent child will be required, as per the sponsoring union, to upload a marriage certificate for a spouse and birth certificate for children. The billing, everything is done by auto debit. You can either enter a credit card or ACH. We send notice of invoice on the 10th, on or around the 10th. It really depends if it's a weekend or a holiday, and then it would move a day or two forward or back. And then we process payment around the 12th or the 13th, again, depending on holiday or weekend. So all of that is done automatically. You would enter when you're setting up your portfolio, your group profile, you'd enter your payment method. You can change your payment method at any time. We don't house the information on our system. It calls out to our payment processor, saves what's called a token ID, and then comes back. So then we can process it monthly. So that really kind of concludes the overall information about the program. We do have a concierge team that is available to help you with any questions, concerns. If you need additional information, whether it's the formularies, whether it is information on the ancillaries. When you do go into the platform, you will be able to click on the plan links and it will give you additional information about the benefits. So we want to provide you with as much information as possible so you can make a decision, a comfortable decision about if this is the best program for you and or your family and employees. So thank you. Does anyone have any questions?
Thank you, Bridget. I know we are all very excited about this new program. I do see some questions coming in, and again, you can just type your questions in the question box and we will make sure that we have the time for Bridget to answer them. So the first question I have here is this a group plan, and do I have to offer it to employees?
Good question. So this is, it is not an employer-sponsored health plan. It is a member benefit. So an employer can, if they chose to, offer it to their employees, but they do not have to. Each person that enrolls becomes the associate member. So if just the owner wants to offer it, that's fine. They can take it. But being that this is a member benefit, there's no participation requirements. There is no contribution requirements. So it really is up to each, designated employer what they want to do. If you do have employees at a later date that would like to enroll and you'd like to offer it, new hires, they have to be actively at work for 30 days prior to their effective date. And then if someone is losing coverage or having a qualifying event, they can enroll as long as they provide that loss of coverage letter. So pretty open. It does provide you as an employer the flexibility to maybe put a few different programs out there for employees.
Okay, thank you. So here's another one. How can I find out if a specialty drug is covered?
So we do have a formulary that is provided by the union, and on that formulary, it will tell you the tier of coverage. So typically, as you'll see in the benefit designs, it says tier 1, tier 2, tier 3. There'll be a notation there. It will also let you know if a prior authorization or if it's excluded. So we can share that formulary with anyone. And then if you need assistance looking up the medication, we can help with that. If it looks like a medication may or may not be covered, we can even go a step further and reach out to the union and see how it possibly is covered.
Okay, and this pertains to auto. So what happens if I'm in an auto accident, and how is that claim paid?
Sure. So the process is kind of a little unique, obviously. So basically, in some cases, in most cases, if someone gets admitted to the hospital or ER due to an automobile accident, the hospital is going to take your medical information. It will get denied due to they don't cover it. But what happens is, and we'll have more detailed information, you will have a certificate of coverage, probably a wallet card for this auto accident rider that you can supply, to the hospital, to the medical providers. And then those providers will know who to submit those claims to. However, the program does kick in after your automobile accident after your automobile coverage. So there's a little bit of coordination, there's a little bit of a delay that happens, but it does go to your auto policy first and then kicks over to this auto medical reimbursement. But we have a TPA and we have folks that will be managing that process for our members.
Okay, another one here. If I already work with a broker, can I continue to work with them?
Unfortunately not. This is not a commercially available product or an exchange product. Being that it is a self-insured program, we don't work with external brokers. So unfortunately, we cannot. That's what our team is here to do. We're not trying to take business away from anyone, but again, we all consult on behalf of the program and provide you with the resources that you may need to enroll.
Okay, and another one here. Good question. Am I obligated to stay enrolled in this program for 12 months once I do enroll?
Not good question. So no, this is a month-to-month program. So if you enroll for February 1st and let's say, went to the exchange or someone got hired by another company and had other coverage, then you can terminate your coverage prior to the effective date, right? So it is month to month. You're not obligated for a 12-month period. If you do terminate and want to come back in, you'd have to wait till the next open enrollment, which is January 1st, but you're not locked in for any period of time.
Okay, let's see. Yep, here's another one. Do you offer dental and vision coverage? Can you review that, please?
So at this time, we don't. The union does have the ancillary, the specified disease, hospital indemnity, life, and accident. They don't have, they have their own dental and vision, but it's not offered to our membership. So we are looking for other options. Once we have those options, we will, inform the folks at TDA to make it available to all of you.
Okay, I am not seeing any more questions, Bridget, but really want to thank you for your time today. And we're really excited about this new program. It's going to be fantastic for TDA members. Is there anything else you want to add before we go?
We're excited too. We've had a great start so far and have had great feedback from a lot of the folks at TDA. It is a different program. It's unique. I've, been enrolled in the program for the last 4 years, and I've been in every large carrier, and you really don't know the difference. But I think the benefit is our team really is your concierge, your backstop to help you if you have any questions. But it's worth taking a look at, right? So if not now, maybe later. But it does provide to me a lot more stability in the sense that it is a large employer. You don't have to worry, God forbid, if you get sick, what's going to happen to your rates, or even from an exchange perspective, if you get a subsidy 1 year, what happens? So, from an employer's perspective, it doesn't lock you in as far as being, employer sponsored. So it really does give you some options and alternatives for yourself, your family, and your employees. So we're just happy to be working with you and look forward to growing the relationship.
Yeah, and like Bridget mentioned earlier, we do record these webinars and we will be sending them out via e-blast. So, keep an eye out for that, and feel free to forward the link to your colleagues as well. You can also find the information on the TDA Perks website, tdaperks.com, and we look forward to hearing from you. So thanks again, Bridget, and have a great weekend, everyone.
Great. Thank you. You as well.